Thank you. Good afternoon, everyone, and welcome to the Local COVID Outbreak Engagement Board meeting. We'll go straight on to the agenda. Item 1 is just a welcome and introductions. So I'm happy to go around and do a quick round of intros. I'll also just note that I'll be chairing this board today in the absence of the leader. And I think some of the people in this meeting we may already have met. So for those who we haven't met, I'm Councillor Mariam Khan, and I'm the new Cabinet Member for Health and Social Care. So it's good to meet you all if we haven't already met. And I'm just going to sort of look and see who to bring in. I'm going to go in the order that's on my screen, and you can just do a quick hello, hi, and we can carry on with the meeting. So Matt.
Thank you. Matt Share, I'm the police commander for Birmingham East, but I also cover the whole of Birmingham for health and wellbeing matters. Thank you. Okay,
thank you. Kate.
Hi everybody, I'm Kate Woolley, Director of IMS and Vax for Birmingham and Solihull, currently CCG, soon to be born into an ICS.
Very soon. Justin?
Hi, I'm Dr. Justin Marnie, I'm the Director of Public Health, Birmingham City Council.
Councillor Tilsley?
Paul Tilsley, health freak and member for Sheldon.
I'm just Councillor Bennett.
Councillor Matt Bennett for Edgbaston, Shadow Cabinet Member for Health and Wellbeing.
And then sorry, it's because some people have got cameras on and the others are the little icons, so I'm just having to look at the people list on the side. Toyin.
Hello, I'm Toyin Amusin. I'm a consultant in public health for Birmingham City Council, and I head the Test and Health Protection Response Team of Test and Trace.
Thank you. Stephen.
Hello, I'm Stephen Raybould. I am the voluntary sector rep on this board.
Thank you. Nadeem.
Yeah, hi everyone, my name is Nadeem Mohammed. I'm the service lead for Test and Trace Comms and Engagement Team.
Thank you. Emily? Doesn't seem to be here anymore. Damilola?
Yeah, good afternoon everyone. My name is Damilola Kishelire, Public Health Consultant, Test and Trace.
Andy?
Afternoon, everyone. I'm Andy Cave. I'm Chief Exec of Healthwatch Birmingham.
Thank you. Simon?
Hello, everybody. I'm Senior Officer Intelligence and Governance in the Test and Trace team. Thank you.
I think that might be everybody, apart from Mary Orware, who I think is still on hold. So happy to continue. If there's anybody that I've missed out, please do step in now and introduce yourselves. Okay. Thank you. So this is just to advise that the meeting is not going to be webcast or live broadcast, but it will be recorded on Microsoft Teams, and then it will be uploaded onto the council's YouTube site. If anybody has anything to say, please just use the chat function or just raise your hand. And then if I can just ask for sort of housekeeping generally, if we can just switch off mics and videos when we're not speaking. If that's okay. Sorry, somebody's sick. Richard, we've just done quick intros. Would you like to just introduce yourself? I've just noticed that you've joined.
Yeah, sorry, I was stuck in the waiting room. Hi, apologies. I'm Richard Burden. I'm Chair of Healthwatch Birmingham and Healthwatch Solihull.
Thank you. Okay, Apologies I've got from Councillor Ward and Councillor Jones, Deputy Leader, and also Paul Sheriff. Does anybody else know if we've had any other apologies for this meeting? No, okay. Are there any declarations of interest? None? Okay. And this is minutes, just to confirm and sign off the minutes of the meeting held on the 27th of April. I'm going to have to take everybody else's lead on that because I was not at that meeting. So just if I can get the go ahead to confirm them.
Agreed.
Thank you. And then if I can bring in Dr. Justin Varney on item 6 for the COVID-19 situation and vaccination update.
Thank you, Councillor. So I'm just going to share my screen with the slides that are uploaded onto the website and just draw out some of the highlights for the board. I think the key highlight to really flag is that, of course, because the national policy on testing has changed, that we are continuing to see less accurate data. And now this is a point at which I am concerned that there will be misinterpretation of publishing the data in this way, because we are seeing significant skew based on the testing patterns and who still has access to particularly lateral flow testing. And that's why, in essence, we are seeing high numbers creeping up in terms of hospital admissions in and over 60s, because there is still active testing in care homes and in the NHS, particularly where there are cases identified. However, that is not translating into deaths, which is the diagram to the far left. It's also not translating into acute hospital admissions for COVID. So what we are seeing is more people now in hospital who have COVID, but that's not the reason they're in hospital. And it is no doubt a reason that's contributing to them being in hospital, in that whenever you've got an infection on top of something else, you are undoubtedly sicker than if you didn't have an infection. So it is making things worse, but it's not the baseline reason that they've been admitted. So we will talk later in the agenda about the future of the board, but I am increasingly concerned this data is now not representing the picture. And while we don't have access to mass testing, it skews people's understanding of the reality of the situation. The vaccination picture remains relatively positive, and I'll skim down to that in a second. But just to pause on the maps of the city, this demonstrates the point that I was making around the skewing. So in both of the areas which are marked blue, this is not a reflection of large-scale community transition. This is around, we have 1 or 2 care homes which have outbreaks, which we know and we're managing. Unfortunately, unlike previous waves before the vaccine programme, we're not seeing these translate into many of our most vulnerable and elderly residents having to go to hospital or dying, and that is credit and testament to the impact of the vaccination programme. I'll touch briefly on variants of concern. We are seeing some new variants emerging globally in terms of the Omicron virus, the Omicron variant of COVID. So BA4 is the one that you will start to hear people talking about, I think, more in the media. Now, at the moment, the international evidence is the vaccine is holding well against BA4 and BA5. However, there is some anecdotal reports that if you catch BA4 and BA5, you do feel pretty horrible with it. And that what we're seeing is that although the vaccine is preventing severe illness, people are really experiencing COVID in the current wave as very nasty infection. People really do feel washed out and quite unwell, but not unwell enough to require medical intervention or require going into hospital. But there remain global efforts to monitor this. And as we've talked about previously at the board, until there is good global vaccination, we are likely to see continual variants appear across the world. As you can see, testing rates have fallen, and we continue to see that downward trend since the access to mass testing was switched off. We literally today have just had a communication from the Department of Health that will be being cascaded out to care homes and to vulnerable settings such as homeless shelters on how they're able to access kits if an outbreak occurs, and that has literally come through in the last hour. So the board will forgive me that I can't go into the detail because I haven't had a chance to fully digest it yet. But we are seeing, and as I said, this pattern of those that contest, we're seeing the case rates have risen, but that's not translating into hospitalization or to deaths, which is good. And that's particularly clear when we look at the data in the slide pack on hospital metrics, where the fact now that we only have one person on mechanical intervention across all of our hospitals. And colleagues will remember to perhaps even just a year ago this time, and those numbers were in 40, 50, 60 across the trusts of people in intensive care, which was consuming our capacity in intensive care to support patients who needed coronary heart bypass surgery, for example, and required intensive care for their post-operative recovery and couldn't get into it because a COVID patient was in it. So this really is testament to the impact of vaccination. And we see that, as I said, through the deaths, and we are now well below the 5-year average for deaths. Following the last board, we did do further analysis of the death rates, and we've been in communication with Councillor Tilsley around some of the nuances of this and the challenge of which version of death is a COVID death, i.e. is it on the death certificate of call, or is it the primary cause of death on the death certificate? And some of the board who were with us at the start of the pandemic will remember in the first wave we did do a deep dive with the local NHS system into mortality, and there is a clear correlation between pre-existing health conditions, the reality of whether they are well managed or not, both by the individuals and by the NHS, and the increased risk of dying. So comorbidity of another condition is definitely an associated risk factor. And we knew coming into this pandemic that Birmingham was poorly placed compared to many other cities in terms of the baseline health of our population. And on the eve of the formation of the NHS integrated care system, this is something that the NHS, I think, has heard loud and clear, and I'm certainly seeing in the key documents being developed, that there is a recognition that we have to close those gaps, that the NHS has to support citizens better, and we as council play our part in changing the environment of the city, whether that's the food environment through the food strategy that's in consultation, the work we're doing on the transport infrastructure to enable everyday physical activity, or the work that we do with employers across the city to make a real living wage a reality for everyone in Birmingham. All of those things are coming together to reduce the risk of those morbidities being a cause of death in the future. Obviously, I think this will be an area of investigation for the public inquiry, and we are preparing across the council, as other partners are in the city, for the public inquiry, which we expect to start requesting evidence in September and October. I know Nadeem and Damilola will be covering some of the community engagement in the following items, so I'm not going to dwell on that in detail, other to say that I'm incredibly proud of the work that the team have done. And I personally just want to highlight this innovation around peer mentoring program, which Damilola and the team have developed, which is really focusing on how through peer mentoring we can support young adults to develop health literacy and their understanding of the health service, and through that work increase their appetite for vaccination and their understanding of vaccination. And this is kind of the next level up from the COVID champions, which was more about information dissemination. This is about enabling change through everyday conversations, peer to peer. And I'm really delighted about the work that the team has done in this space. So I do want to just highlight that to the board. So I'll stop there and happy to take any questions. The board also have access to the vaccination update report, which has been updated, and we continue to see improvement in vaccination update. I know Kate is with us at the board today. It is fair to say it has slowed, and we would expect it to slow in the reality that the people who were very keen to get the vaccine got in and got it early. We're now really working on the people who have been reluctant, many of those are continuing to change their mind every day. For some, it's reached that critical mass of I need X 100,000 people to have it before I feel safe having it, and that's a real step forward. And of course, because we are a young city, that children only recently became eligible to the vaccine, and that is overall skewing our numbers. But it continues to be an area of partnership and collaboration with the NHS, and we can see in the data that's presented that the vaccination journey still has a way to go, but is a significantly greener and yellower chart than where we were a year ago when this was a chart covered in reds and ambers. So some real progress there. And I'll stop there. Happy to take any questions from the board.
Thank you, Justin. I've got indications from Councillor Tilsley and Stephen, so I'll take them in that order.
Okay, thank you. Justin made reference to my version of the truth, which I circulated, and the concern that I've got and what led me to it was that we had some death rates given to us about 6 or 7 months ago, if I remember correctly. And I felt that Birmingham was out of kilter, particularly with Leeds, which is our nearest comparator, because we've got a population of 1.1 million. Leeds have got a population of 750,000, and we seem to be out of kilter as far as the deaths were concerned. And that set my mind active. In the statistics that Justin has provided, Liverpool come out of the core cities as having a higher death rate than Birmingham. But there are two versions of the truth, if you like. There is the death certificate that attributes death solely to COVID. And then there is the comorbidity issue, where COVID is a contributing factor to the death. And perhaps, who knows, those that have passed on may have lasted another 6 months, who can tell, but their life was cut short. So I've taken the higher figure, and I get the death rate at 0.37 for Birmingham compared to Liverpool on the same basis at 0.31. There are some quite startling figures when you look at them. Manchester comes out at 0.3118, whereas Bristol is 0.20, completely out of kilter. Now, as Justin has said, there could be a whole variety of reasons for this. My concern is that, as I said in the paper that I produced earlier in the week, it could well be that in the haste that our NHS colleagues had to free up beds, that people who had COVID were moved on to nursing homes and secondary care. And that could have contributed to the higher figures that Birmingham has got compared to other cities and core cities. But I just wanted basically to put an alternative on the table, so that when we start to have a wash up and look at what happened, that we can take it in the round and look at the two figures, one attributed solely to COVID and one attributed to COVID being a contributor to the death. So it's just a piece of work that hopefully enlarges the debate, which is what I was intending to do. Thank you, Chairman.
Thank you, Councillor Tilsley. Happy to go straight to Stephen next, and then Justin, you can respond. And I have noticed, Councillor Bennett, you've got your hand raised, but we'll come back to you.
There's a couple of questions I had. So the first one was, given that the data is becoming poorer, what are we using as an indicator that would determine if we needed to change course? So that was the first. And then was, will the public inquiry engage with community organisations and citizens at either at a local or a national level? And then thirdly, just to coming on the back of what Councillor Tilsley offered, our understanding was that the evacuation of people outside of hospitals was done on a national instruction. Certainly, that was the message that we were given. I'd be interested to hear if that wasn't the case, because I know it impacted quite heavily on voluntary sector organisations, specifically care homes within the sector.
Thank you, Stephen. Justin, are you good to take Councillor Bennett's question as well, or do you want? Yeah, okay, Councillor Bennett.
Thank you, Chair. I don't know if it's a question or an observation, really. Obviously, as Justin said, the take up of vaccine, or the having children having the vaccine, is relatively new, and we've got quite a low take up so far. I mean, we are obviously in the summer months now, and I just wonder if a lot of parents are deliberately holding off until the autumn when they expect that cases will rise, and that I think I read quite a lot in the media about how with the Omicron variant, the vaccine, the effectiveness, it's not effective for quite as long. So it probably makes sense, or parents might be thinking it makes sense to hold off until closer to the autumn, so you've got that maximum time of efficacy of the vaccine when the virus is more likely to be on the rise again. I don't know if that's the case or not, but I just wondered if it might be.
Thank you, Councillor. You're happy, Chair. I'll come in and respond to those. And I believe Kate's with us, so I might ask Kate to just give a brief few words on the forward plan for the vaccine programme in a minute. So just pick up the point Councillor Tilsley made around the deaths and morbidity, and the point Stephen picked up on the discharge. The national inquiry is the national inquiry. We don't have an ability locally to supplement or to influence it. We will be asked questions. We have, in the preparation for the inquiry, expressed views that there should be a regional basis to it, and it is really important that the inquiry does hear citizens' voices and community stakeholder voices, as well as statutory agencies. But it will be for the inquiry to decide its lines of inquiry and who it asks for evidence, and you know, that is the reality of these things. The death and the morbidity picture is something that is complex to understand and to unpick, not least in having spent the first part of my clinical career, sadly, doing lots of death certificates, where that you have your primary cause of death, and then you have up to 3 supporting causes, contributing factors. Where COVID is put in that order, you need to get out death certificates to look at, and then look at. It's quite an in-depth piece of work, and I think that the kind of value add of doing that is not necessarily high at this stage, in terms of the key takeaways are, one, around the discharge. I think that will be picked up by the public inquiry. If it is not, then I think the NHS and social care will want to look at it locally, but that's a decision for the Director of Adult Social Care to consider. But the second is that fundamentally, if all of us were in better health at the start of this pandemic in Birmingham, that death toll would have been lower. And we have to prepare for the next pandemic, because there will at some point be something else that comes along, and it will be the baseline health of the population. And I think for Birmingham, with the great energy that we have of the Commonwealth Games, with the learning and the lessons from the pandemic, we have to really now make a very strong commitment to closing those inequalities and really moving Birmingham from being, one of the poorer cities when it comes to the health of our population to be one of the best. And that will be, for me, the positive to come out of those 3,500 plus deaths that we lost due to COVID, is that we prevent that kind of death toll in the future by really investing in closing those gaps. And I think I'll hand over to Kate to pick up on the vaccine one. We are doing a lot of work on vaccine literacy in general, because I think we've heard the fatigue people have of talking about COVID. So, you know, I think it's a really important pivot in the way we're approaching this. And obviously with the monkeypox issue coming on nationally, we have a very specific drive at the moment on how we can close the gap in some of the areas of the city where the polio vaccine is not as good as we would like. So it really is a kind of combined effort. So Kate, if I hand over to you, if that's okay.
Thank you. Yeah, I think there has been some ambivalence from parents, some decisions to make about the when, that's for sure. I think if we cast our minds back to January, we did have quite a lot of children who had COVID, so that did have an impact on when they were able to take up the vaccine. So the launch of that has been relatively recent, as Justin has said. I think certainly the introduction of the offer for the 5 to 11s, we've seen very low uptake. So nationally, there was a push for it to be at 65%. We said we wouldn't get more than 20%. We've probably had about 7%. That's not to say that's right or wrong, but obviously for the vaccination of children that age, it's not for the benefit of the child, it's for the benefit of others. So there is that question mark in parents' mind about uptake. We have had a big joint push through the comms channels on children who are 12 to 17. We recognise that between now and the end of the summer, we've got a real opportunity to encourage uptake. And the levers for that we're using are around the ease of going on holiday, the convenience of not having to test, the added protection that you will get if you have it now. But we're now reaching the stage where parents will be making that decision if the spring booster is ending, is vaccination ending? We're trying to make sure that we craft a really positive joint message with partners about obviously the summer, everyone's outside, it's still available as an evergreen offer for everybody. I think we would want children to be protected before they go back to school, and there isn't a children's programme in the autumn winter plan. So we are going to do our best to push that through July and August to make sure uptake is the best it can be. And then the final thing I wanted to say is that obviously we are planning for autumn winter with a very strong focus on health and broader inequalities to make sure that we're working with Justin's colleagues to ensure that we've got the right focus, that we've got the right messages, that it's not just about a COVID vaccine, it is actually about how we can support the direction of people to services that they do need. Without that, I think it's going to be a tough ask in low uptake areas, and we have to think about what's the incentive for somebody to come and talk to us about a vaccination. So we need to be making sure we've got other offers that we can direct people to accordingly. And obviously that means that we're wrapping into that conversation, generally encouraging people to take up their childhood immunisations if they haven't had them to date. So over July and August, we're not going to be slacking, but we are going to be focusing a lot on low uptake areas. And in addition, the Commonwealth Games is here, so we don't want to be in the middle of all of that. We want to be in communities where we can really make a difference. So that's what we're going to be doing July and August. Hope that's okay.
Thank you. Thanks, Justin and Kate. Councillor Tilsley, can I just check to see whether you raised your hand again or if that was raised from the previous question?
I'm sorry, Chair, it's a legacy.
Perfect, that's fine, no problem. Thank you. In that case, if we don't have any other questions on this item, I'm happy to move along to item 7. Nadeem, if you can give us the update or present the item on communications and the engagement forward plan.
Yeah, will do, Councillor. Just give us a second. I'll share my screen. Okay, in terms of our shift from comms and engagement, we're shifting from COVID-19 work streams to living with COVID. That includes vaccination uptake drive. That also includes the life course vaccination. This continues to be a priority as vaccination in Birmingham is still below the national average. It's getting better, as Justin said, but we're still pushing for vaccination uptake. In terms of the promoting safer behaviours, we are still mitigating some of the transmission risks out there. We're still promoting safer behaviours, supporting existing and new community engagement activities. This will help to amplify the work where relevant and demonstrate how Birmingham City Council is working in which to build trust and help the underreached communities, provide information and support to Birmingham and Birmingham residents affected by long COVID, supporting citizens to reduce the modifiable risk factors associated with increased COVID mortality, such as smoking, obesity, and long-term conditions, to use intelligence from key health indices to develop risk reduction messages, target seldom heard communities with public health messages, including long COVID, including linked to mental health, isolation, and immunisation. In terms of the forward plan, we've adopted a data-led approach to identifying wards and communities where vaccine uptake is low, and to increase access to vaccination opportunities in these communities. Also to increase outreach and engagement through one-to-one focused contact to understand local barriers and needs, raise awareness of local support, public health guidance and other support for residents in high-risk areas. Continue to work alongside other existing strands of community engagement provision to target wider public health messages and develop impactful content. In terms of the current work streams, there are 4 strands of work to address low vaccine uptake. This is the hyper-local COVID-19 vaccination. This work will be delivered short and targeted approach to improve vaccination rates in Birmingham, targeting the 10 wards with the lowest uptake. And essentially, it's working with the NHS with the vaccination van to identify suitable locations. We previously ran a campaign from the 23rd of May to the 28th of May. Our next phase or tranche is the 4th to the 17th of July. The Vaccimmune engagement project. This is generally about uptake around life course, general vaccination uptake around life course. There are 2 community providers that have been successful in terms of money being awarded to develop community engagement to increase vaccination uptake. And the 2 community providers are Orbiter and Bahu Trust. And the project will run from June till September. The 3rd strand is the Department for Levelling Up Housing and Communities fund. This money will fund several projects, one in which is the Community Immunology Training Programme. The programme aims to develop a network of residents, vaccine champions who will be able to engage effectively with peers, answer questions and concerns about life course vaccines with a focus on COVID-19 vaccinations. The British Society for Immunology will be delivering the training in July to roughly 20 to 25 vaccine champions. The 4th strand is the JabCab initiative, which began in December 21 for individuals and families who could not get to vaccination centres. The smoking cessation campaign raises awareness on how to access free smoking cessation services and courses via the pharmacists and GPs, increase the number of sign-ups and completion of smoking courses to quit smoking. This also includes raising the awareness about Quit with Bella app and increase the number of app users as well. The campaign raises awareness around risks of smoking on health. There's currently an online survey to sort of gain a baseline understanding of smoking habits within Birmingham and awareness of smoking cessation services. Now the survey is open till the 10th of July, and also in July there are several mobile pop-up events that will be happening with street engagement teams. They will be conducting face-to-face surveys, handing out leaflets and goodie bags, and talking to citizens about the campaign. Justin's already mentioned the peer mentoring program. It's targeted at 18 to 35-year-olds. Just to let you know where we are with that currently, there's an online survey that was conducted in June and now it's closed. And really the survey was to just get people's opinions on what sort of training they wanted, how would they deliver these events, would it be via social media or would it be face to face? So we're currently analysing the responses, but the next steps are to arrange the training, and there's a training session that's happening tomorrow around mental health. All the volunteers will receive a certificate of attendance. Once they receive the training, they will then work in partnership with public health, and we will help them and support them to deliver some of their events around events to their peer groups as well. To date, we've had 121 enrolments, which is an excellent number. And the training choices were mental health, sexual health, physical activity, alcohol and substance abuse, food diet, healthy eating, and COVID-19 training. Our approach is pretty simple: to establish a diverse network of health champions, and deep engagement partners, supporting information, dissemination, feedback from communities on health improvement, two-way communication and engagement to support civic and community action on health improvement, to establish a clear framework for community-led insight and research. And essentially what this involves is sort of a three-phase approach. So the first phase is the community engagement and two-way communication, upskill champions and engagement partners to feel confident to share public health messages. Number two, community need, understand the different community, particularly the seldom heard ones, tailor information using localized accessible resources, local digital media, press, social media, non-digital, development of a comprehensive training package for champions and faith leaders to transition into various levels of engagement opportunities. And finally, community empowerment, utilize reflections, proactively collate regular feedback from communities and incorporate feedback into continuous improvement. Okay, great. Thank you very much. Are there any questions?
Thank you, Nadine, for that presentation. I'm just going to pause to see if anybody does want to raise their hand to ask a question. And in the meantime, I'll say that it's really impressive to hear about all of the different various aspects of the programs that are in place in relation to engagement. I know that quite a few of them I've heard already in our briefings, but it's good to be able to see them all together and see all of the different ways in which engagement has been taking place. So if anything, I echo what Justin said at the beginning about all of the good work that has been done in that. So well done to all of the team. And whilst I have been talking, I don't think that I've got any questions for you. So I can just again say thank you for your presentation and your update on the communications and engagement forward plan, and then move on to the next item, which is the Commonwealth Games update. Can I bring in Dr. Mary Oroware to present this item?
Yeah, good afternoon.
Thank you.
Okay, so this is in our slide pack. Should be sharing. Great. So I was asked to give an update on a public health games time preparedness, and it's an update on following my previous visit to this board. So I'm not going to go over everything, but as we are getting closer to the games, it is sort of a culmination of work that has taken many months. So the key things that we've done since the last time I was here is we have conducted our final readiness exercises, and exercises are situations where we test out to see whether the plans we have in place and the ways in which we think those plans will work actually work as best we are able to test them outside of a live situation. So we've been part of many such exercises. The most recent one was very much focused on what local authorities would do, working with the UKHSA and other partners. There's also an MOU being produced, which is a memorandum of understanding that will set out how we may work. Some of this is because, UKHSA is a relatively new organisation, and we're just working through how we might do things going forward, but also using the Commonwealth Games to to put a specific lens focus on it. So our post-exercise plans have revealed a number of areas where we need to just close a few gaps, just making sure, belt and braces, making sure that we have the right things in place. So we closed some gaps with NHS, just making sure that, again, we know who to call, not just knowing that we call the NHS, but which bit of the system to call, but understanding they are ready, expecting to hear from us should we need them. We've also had some similar conversations with the organising committee, and there's some final planning arrangements obviously going on with DCMS. Beyond the multi-agency working arrangements and testing our readiness for any situation that we could reasonably foresee, the main other issue for us has been, understanding what our surveillance strategy would be, because that's how we get notified that there might be a situation that needs dealing with. So we've got all our regular situations, all our regular measures in place for providing information, predominantly through the UKHSA. They have taken some additional measures to get information from the various Commonwealth countries that we'll be visiting, or rather whose athletes will be visiting. But we are very mindful that not all of our athletes will be coming from those countries directly. They may be coming from other events that are happening internationally. There's a whole programme of events that athletes attend. And so we're widening it beyond just the Commonwealth nations that are taking part. That information is going through to the UKHSA on a regular basis, and we're staying alert to anything that may be relevant to us and how we manage the games. Our aim is to offer a safe games time experience to our games family, so that's our athletes and our officials, to the workforce, so that includes the volunteers as well as the paid workforce, to our visitors, and last but not least, also to our residents here in Birmingham. And when we're looking at preparedness for situations, we're not just looking at the sporting events, we're also including the over 200 cultural events that will be taking place. Those conversations about how things may work in that regard, closing off any loops, is what we've been working on. We have identified our routes of surveillance, but we are mindful that we'll also have soft information. And in recent weeks, the situation with monkeypox and more recently concerns about polio has been a really timely reminder for us that we need to be ready for all of the things we need to do to protect people, and not just COVID. So lots of work been done, and I think we are in as reasonably a good place as we could expect to be at this stage. Happy to take any questions.
Thank you, Mary, for that update. Can I just see whether I've got any questions or comments from anybody on the board? None? Okay. So thank you again for your presentation, and happy to move on to the next item. I don't know, Mary, whether you picked up the comment from Kate in the chat.
Yes, we've asked for people to be immunised, both for workforce and athletes. We've even asked for athletes to ask their parents about what immunisation they had as a child, so that if they crop up with anything, we know their history. So thank you, Kate.
Thank you. We can move on to the next item, 9. I can bring back Dr. Justin Varney to give us a bit of an update on the future of this board.
Thank you, Chair. So colleagues will remember that we've started to reflect last time on the future of the board, and it is no longer a statutory requirement to have a COVID local outbreak engagement board. and many other areas, both in the West Midlands and nationally, have stood down their boards some time ago. However, we felt because of the Commonwealth Games coming, it was important to maintain confidence and to give members the ability to have oversight. Now we are, I think, 30 days out from the Games. It might be even 29 now. I feel that there is limited value in continuing the board, particularly also as the data collection is becoming less reliable, so the reports we're able to provide. And apologies, I didn't pick up Stephen's point previously around how do we know what's going on. What we've now switched to nationally is a model which follows the way that we do flu surveillance. So we have a series of sentinel practices that are representative in their distribution across the country, and we continue to do random sampling of people who present with respiratory symptoms to check from COVID, and that's very similar to the methodology we've had with flu, which works well and is internationally recognised as good practice. So this paper sets out a recommendation to the board that we stand down the local outbreak engagement board. And we can, of course, stand it up should we see a significant surge pattern or issue of concern. And it would be suggested that that would be re-established on discussion with either the leader or the cabinet member as chair of the board, of the Health and Wellbeing Board. And that we continue to monitor the situation through the Health Protection Forum, which is a subgroup of the Health and Wellbeing Board, alongside what we do for flu and other infectious diseases. So it really is asking for the board's approval to proceed with that plan, given where we are in the pandemic and the response.
Thank you, Justin. Can I bring in Councillor Tilsley?
Yeah, I've listened, I've read the paper. I can't really argue too much against it, apart from the fact that we do have the Commonwealth Games. There is going to be a meeting of people from 50 countries in Birmingham, and I wondered whether there was any value in having a meeting in September to evaluate what has happened. That would be my only comment.
Okay, Justin, you've got another comment from Stephen in the chat that you can have a look at in the.
Yes, Chair. So in terms of the September suggestion, Councillor Khan and I have been starting conversation around whether we have, and I'm somewhat loath to call it this, but in a sense, a kind of COVID learning and reflection event in the autumn to help us really crystallise what have we learned on the journey, and that being something which is a much, in effect, kind of mini conference to really bring people together, to allow us both to share and breathe out what has been 2 years of immense response across the city partnership, to also take that into action learning in the way that I think the Citizens UK Forum recently Assembly really demonstrated. It's not just a talking shop. How do we concrete and condense down what is it we need to take forward in a meaningful and sensible way? And that, of course, will consolidate also some of the learning from the period of the Commonwealth Games, of which COVID is a very specific section, but it is not the totality of the response. So I acknowledge Councillor Tilsley's point. My suggestion is we might merge that into that event rather than holding it as a political committee in the way that the Outbreak Engagement Board is. I think it is also sensible, with your permission, Chair, that we bring a paper to the September Health and Wellbeing Board on reflections on the learning from the Commonwealth Games in terms of that health protection response, so that it's formally logged through the Health and Wellbeing Board, which is a public member-led meeting as well.
Thank you, Justin. Yes, so I think that we have had obviously discussions about this before it came to this meeting, and again, I pretty much agree with the reasoning behind having the option of stepping it down at this stage. I'm keen to hear from Councillor Tilsley the response back based on what you just said around the September thing, and I know that we're looking to not kind of bring everything to a close around COVID, because it still exists, but it's more of a COVID in the form of the pandemic that it's been, and I do understand the logic and reasoning behind having some sort of evaluation or reflection post games from a health perspective, but I definitely think that for me as chair of the, away from this kind of capacity, but chair as a health and wellbeing board, bringing something there in order to ensure that those reflections are captured is really important and key. But before anything else, I'll bring in Stephen. I see that you've got your hand raised, but I'm only going to bring Councillor Tilsley in now just because I think it's in response to this, and then I'll bring you in straight after Stephen. Councillor Tilsley.
Thank you, Chair. I hear what Justin has said, and there will be a wash up and hopefully learning from the pandemic. I'm quite happy with that. If there is a paper to be presented to the Health and Wellbeing Board, could it also go to the Health Overview and Scrutiny Board as well?
Yeah.
Thank you.
Do that. Thank you. Stephen?
So I just really wanted to support, not necessarily sustaining this board, because I'm in agreement with the paper, but we need the learning from COVID distilled into a way that the system can absorb it, and I don't think we've quite got there yet. So producing something that would enable all partners to participate in preparing for the next pandemic would be really helpful.
Good. Thank you. I think it's good to hear that, though, because we're definitely in conversation about how we can bring something, not just so that we can reflect on COVID for the sake of reflecting on this pandemic, but definitely enable us to, if we need to, use something like that in the future. And if it's in a you know, a paper format, but also supported by an event bringing people together, then so be it. But pleased to hear that there is support for that, because Justin and I were having those conversations, and I know that others are having similar conversations about finding some sort of space to bring it to a close, but also formalizing something so that there is real learning that can come from it. Okay, in that case, then, if we've got no other sort of questions or comments on this, then I will I'll take that we're okay to step down this board moving forward, but we'll ensure that the suggestions around the sharing of whatever document is, obviously people on this board who are interested and want to be involved in that sort of, I'm going to take Councillor Tilsley's words, what which obviously it isn't, but then we'll ensure that that takes place as well. We'll move on now then. Item 10, there are no public questions for this meeting, so we can swiftly move on to item 11. Can I bring in Justin again?
Thank you, Chair. So the board is asked to note the budget progress report. I would share with the board that we are now required to provide more granular evidence to the Department of Health than previously expected on the carry forward. And fortunately, because we have had such a robust budget management approach, we're in a very good position to do that, so we can account for where the conf money has gone and where it has been spent. We continue to hold back a reasonably sized contingency for the Commonwealth Games, and we will continue to hold on to that in light of any potential risks, but we are mobilising some of the programme contingency to help us in that learning piece. And as Stephen said, I just signed off actually yesterday commissioning an external provider to do a series of interviews with partners around the pandemic response, so that we have a consolidation report before we get to the autumn event from someone external who's not been part of the system, that will talk to partners and get their honest reflections about where we could have done better, because this was a new experience for all of us, and one that I hope in our careers we don't have to repeat. So I think that will be part of the journey. So yeah, really just to ask the board to note this, further reporting on the conf will be done through the Health Protection Forum. So that means we retain a governance reporting loop for this money. But as I said, the Department of Health is now increasingly requiring the same level of reporting, or a similar level of detailed reporting to what we had a year ago. And that should also provide the board with assurance that the money is being spent in line with the criteria of the funding stream. But happy to take any questions on the budget.
Thank you, Justin. I'll pause to see if we've got any questions or comments, and if we haven't, then just to check that that's agreed.
Great.
Thank you. And then on that note, finally, if we've got any other urgent business. None? Okay. I don't know if that's a record time. Less than an hour.
Closer.
Sorry?
Very close.
Okay. Thank you ever so much, everybody, for being here on this meeting this afternoon. And oh, Justin has something.
Yeah, I just want to put on record, Councillor Khan, the gratitude to the members of the Local Outbreak Engagement Board. You have been with us on really the roller coaster of the pandemic. When I think we first came together in June of 2020, we really didn't know the journey that we were going to face as this pandemic goes on. So I just want to personally put on record as DPH my gratitude towards the members of this board, because you have helped both hold me to account and the council to account, but you also have done so in a truly cross-party and cross-organisational collaborative way, and that's been the heart of our response as a city to the pandemic. So just a thank you for everyone if this is now our last meeting as a board.
Thank you.
Thank you. Thanks, Richard.
Yes, thanks. Well, while we're on the subject of thank yous, and I just also like to echo my thanks to everyone else on the board, but particular thanks to Justin. I mean, he has been the linchpin of this board all the way through, and the work that you and your team have done has just been absolutely tremendous throughout, Justin. So I'm sure I speak on behalf of everyone saying thank you for all your efforts.
Thank you.
Thank you. That's a lovely
Great.
note to end on. It's my first and last meeting of chairing this board, but no, definitely echo the comments made from both Justin and Richard, because you know, the work of this board has definitely been important in leading not just the council but the city through this pandemic, and hopefully we'll see this as the back of the pandemic, but definitely good relationships being built. For fingers crossed we don't end up in a situation like this, but at least we're prepared, and a lot of the work has already been done. Thank you so much once again, and I wish everybody a good rest of the afternoon. Bye everyone.
Thank you.